And welcome back to Ask the Doctor. I'm Mike Berger. Here to answer your medical questions on pain today, Dr. Robert Bulger from the Southwest Pain Group. Just call the number that you see on the screen. It's 1-888-572-4411, or visit the website at www.southwestpaingroup.com. Doctors, without going into too much detail, or in this case, doctor, because Dr. Rodriguez is with us today, can you share with us one of your most interesting or one of your most challenging cases?
Well, you know, during the break, I mentioned this case to you, and I think the audience, your listeners, would like to hear about this.
I think they'd be fascinated by this.
This is a challenging case. I had a patient who was actually an obstetrician. She's a practicing physician at my hospital campus. She was about 30 weeks pregnant, and she had a bad bronchitis. She actually coughed so hard, she fractured a rib.
And that's not that unusual.
No, it's unusual, and everyone knows a rib fracture is a painful thing. Sure. I mean, it can sideline a football player. So, but here's my dilemma. She has to practice. She's still practicing. The baby was kicking her in the rib.
The broken rib.
And she has to work and take care of patients, so she couldn't take painkillers. How am I going to relieve her pain? Now, I ended up doing some nerve block therapies on her, which can help, but I was a little bit of trepidation here because I didn't want to puncture her lung. Sure. The baby's right there, the lung is there. The ultrasound machine would have been a great thing for me then. Now, I didn't have it back then, this a couple of years ago, but the ultrasound would have showed me the lung, the rib, and all the anatomy, and I would have, it would have been a very comforting thing to have.
And of course, X-ray is not available to you in this case.
Well, you don't want to use X-ray in somebody's pregnant, so that was a particularly challenging case.
So that can now be solved with the help of ultrasound.
Well, I still have to do the block, and
but you know exactly where
I know where to go, and I think I'll feel more comfortable from now on.
All right. I think we have another question, a website question. Maria from Grapevine would like to know, and she says, I'm in recovery for addiction to painkillers, so how do I treat my pain without becoming addicted again? That's a great question.
It is an important question because if somebody's in recovery, it means that they've already gone through the process of weaning themselves off their pain medications, or they're taking a medication like Suboxone. They're probably under the care of an addiction specialist. That we can help these patients. We work with addiction specialists all the time, and there are ways to help her pain, control her pain without having to resort to narcotic medications. Sometimes there's a lot of little things you can do to help with the pain.
Is helping a patient like that with something that's not addictive, is that a little more difficult because of a prior addiction? Has it affected their body, changed their what do I want to say?
Their physiology?
Physiology, any at all?
Probably so, because one of the dilemmas is if you've been used to having profound pain relief from a narcotic, it's very difficult to replace that effect. And so it is a bit challenging. It's like a chef cooking a soup, you know, you have to add some things in, a little bit of this, a little bit of that. And then, of course, you do work with the addiction specialist. And just as an interesting aside, those patients are really challenging if they fall and break their leg, because then they need pain medicine again because they have a fractured leg and they're in the emergency room. So you have to suspend all that, treat them with the pain medications they weaned off of, and start the process over again. So it can be very challenging. I would imagine it would be, but let's say in a case like that where you had to have a narcotic painkiller, does that mean that they'll go right back to the addiction, or do you have a little leeway to work in? No. In fact, and this is a great question, and it could be another 30-minute session. Addiction and need for pain medicines are very different. When someone's got a genuine injury, it's very unlikely they're going to be addicted. Addiction is really a social phenomenon and kind of a behavioral issue, whereas need for medication can be legitimate. So in a case of a fracture with a patient who's been addicted, we in our practice give them the pain medicine they need to treat their condition. All right. We have another website question. Bill from DeSoto would like to know, how can chronic pain therapy be used on a daily basis? Is it always going to involve an office visit? Well, Bill, most of the time it will involve office visits, because one of the things that's important for us in medical practice, particularly in Texas, is we have to document your injury. And we have to make sure that as we follow them on a chronic basis, every couple of months we need to see you. The Texas Medical Board is particularly strict about this, and they want to make sure that patients are getting the medications they need, but the issue of diversion, where medications end up in the wrong place,
sure.
Is very important to Texas. So Texas pain doctors are under particularly a microscope, if you will, about this. And so we do need office visits, Bill, and we can help you, but we're probably going to need to see us at least every 2 or 3 months.
But I would say the good news there is it's much cheaper to come to your office than to have to go to the hospital and do the same thing.
Oh, yes. And maybe I didn't understand Bill's question. If he's talking about the fact that he's in treatment,
sure,
or he's going through some sort of detoxification, yes, it's much less expensive to see us. Most people that are in the hospital are in there because they're literally out of control. Mm-hmm. We can manage most patients' medication problems, chronic pain issues, even straightforward detoxifications as an outpatient.
Dr. Bolger, thank you so much for being with us today. We've had a great show, a lot of information. We hope that we've answered some of your questions. You can always go to the Southwest Pain Group, and they will give you the latest information possible, www.southwestpaingroup.com. Or continue to call the phone number, 1-888-572-4411. And as I said, you can also visit their website. I'm Mike Berger. Thank you for being with us. We'll see you next time.
Thanks, Mike.
Good. Thank you.
This program is sponsored by Southwest Pain Group and features medical questions from viewers. Nothing within the program establishes doctor-patient confidentiality.